1, 2, 3, 4, 5, 6, 7, 8.
8. And Lexi. No,
Did you know that the United States sends over $50 billion in aid to other countries each year? That amount could pay for thousands of cancer treatments and save millions of lives here in our country. I feel that the money being continually sent overseas should instead be left within our borders and spent on something that deserves a lot more recognition than given. I believe cancer treatment should be given free to those who cannot afford to pay. The government owes that much to its citizens, I feel. I've done a lot of research, and I've come to find that more people than realize go without treatment simply because they cannot afford it. All in all, I am mostly concerned with what's going to cure, stop, or slow the growth of cancer in individuals who unfortunately do not have the money to pay for the care they need. According to the National Cancer Society, cancer treatments typically cost between $30,000 and $50,000. Think about how much that really is. Does anyone in here have that kind of money just lying around? According to John Sheffrin of the American Cancer Society, 20% of people with health insurance cannot afford to have the cancer therapy they need to save their lives. If the people who do have health insurance can't afford treatment, then how can the people without health insurance afford it? According to the World Health Organization, based on future projections, cancer deaths will continue to rise, with an estimated 9 million people dying from cancer in 2015 and 11.4 dying in 2030. We could cut that number in half if the government stepped in and helped the individuals who cannot afford to help themselves. If our country can afford to send billions of dollars to other countries, then I feel they can help afford to pay hospitals and treatment centers the money owed on chemotherapy, radiation, targeted therapy, stem cell or bone marrow transplants, and immunotherapy treatments. People without insurance often go without or resort to the non-payment method, which in turn leaves the hospital to cover those expenses. Research shows that this happens more likely than not. To save all the trouble, why doesn't the government use the tax money to pay the debt of the treatment centers? If this plan were to go into effect and the treatments people needed were free to those who needed it, thousands of lives would be saved, and people would be more understanding of where our tax money is going to save American lives. The new Obamacare law went into effect in January of 2014. This law stated that everyone will have to buy health insurance who does not already have it. It was said if you failed to do so, that you would have to pay a penalty that was going to be as much as 2.5% of your total income yearly. According to research, nearly 9 million people gained insurance last year, a win for Obamacare as the president's signature healthcare law expanded. Medicaid and opened health insurance exchanges within the country. And yet, 33 million Americans, 10.4% of the United States population, still went without health insurance for the entirety of 2014. With this being said, there's no surprise that some Americans still don't have health insurance. Despite aiming to insure everybody in the United States, the Affordable Care Act, also known as the ACA, left significant gaps in coverage, and the decisions made by the law's opponents have denied benefits to millions of people who it was designed to help. Remember, as I said before, 20% of people with health insurance still weren't able to pay for the treatments. So imagine being in a situation where you have no help. After hearing my arguments, I hope you will consider and weigh the benefits of having the government pay for the cancer treatments people without health insurance need. The American Cancer Society estimates 3,400 people are diagnosed with cancer every single day. Let's help them have a chance to fight this battle. Besides, the money being sent overseas isn't doing any good in our country. Why not keep our money in our country and put it to good use? Let our own Americans have the right to life. Cancer does not discriminate against the rich or the poor, but yet that is what our country does to its citizens. So isn't it time to take a stand to ensure our current and future patients in the United States are treated fair and equal? So today I hope you leave here knowing that this could impact you just as simply as it could impact me. I hope you can leave feeling inspired to help those who cannot help themselves. Because in the end, who is it that really determines the value of a life? Thank you.